Welcome dear doctors to Kidscovery. I am Dr. Parv, your pediatric faculty. We are discussing immunology and the topic of discussion in pediatric immunology is leukocyte adhesion defect. Now I think from the basic knowledge of your pathology you know that in the inflammation there is a step, okay, where your leukocytes are going to come and combine with the, not combine but attach to the, attach to what? Attach to your endothelium, okay, and this is called as leukocyte adhesion. So this adhesion is actually occurring because of some molecules which are called as adhesion molecules, okay, adhesion molecules, also called as integrins. So something which is integrating, that molecule will be called as integrins. So what is leukocyte adhesion deficiency? There are three autosomal recessive immunodeficiencies. One is called as leukocyte adhesion molecule deficiency type 1, which is most common, then type 2 and type 3, which is caused due to the adhesion molecule defect. Now because the leukocytes are not adhering to the endothelium, there will be no phagocytosis, there will be no chemotaxis, there will be no transmigration to the site of the injury. So what happens normally, for example, this is your endothelium, this is the leukocyte adhesion, and this is the WBC which is going to come here and stick it here. This is called as adhesion, and after adhesion they used to come here with the help of a movement called as chemotaxis. Then they used to adhere and they used to pass this endothelium to capture the organism, okay, going inside the blood vessel to capture the organism. But what is happening? The thing is, the issue is that there is no adhesion molecule, so there will be no no chemotaxis, no transmigration, nothing is going to happen. So why does this happen? I've told you that integrins are a defect, so beta 2 integrin gene mutation, okay. So just to make you remember this, that remember B, beta, B bad, so it's a bad thing that integrins are a defect. So beta 2 integrin is a gene mutation, okay. So which is actually responsible for encoding the CD18. Just remove this here. So which is responsible for encoding CD18, and CD18 is actually the beta chain of beta 2 integrin family. And okay, so basically integrins are nothing but the proteins only, and they have got chains like alpha chain, beta chain. So if the beta chain is at defective, this beta chain is actually also called as CD18, okay. CD18 and beta chain are very similar, are actually the one thing only. So beta chain is not formed, that's why beta 2 integrin family has got nothing. So there is a deficient or defective CD18 expression, and there is a gene mutation which is going to happen in type 1. Whereas in type 2, what is going to happen? There is a GDP fucose transporter gene problem. So in this handwriting, in cursive handwriting, this is how you write T and this is how you write F. So T for, okay, leave this T and F. C, T for 2, T for transporter. So there is a transporter gene, a GDP fucose transporter gene which is not formed. So what is going to happen? The fucosylation is not going to occur. And because there is lack of fucosylation, it prevents the expression of fucose containing selectin ligands. So selectin is also responsible for the adhesion. So selectin ligands are not going to come, okay. And what are the proteins which are responsible for this? One is going to be sialyl Lewis X, and next is going to be H antigen. So both of them are not going to fucosylate, and because they are not fucosylating, they are not going to let the selectin ligand express, okay. I'll just tell you once again. So see, you have got something called as sialyl Lewis X and H antigen. Both of them are the selectin ligands. Both of them are the selectin ligands where adhesion occurs, okay. But because there is, okay, and this require fucosylation. So fucosylation is a process which is required for selected ligands to do the adhesion, but because fucosylation is not occurring, there will be no expression of the selectin ligands. Okay, so this you have to remember. And remember, S and T come very close in alphabet. So S for sialyl Lewis X. So type 2 is going to have sialyl Lewis X, and yes, 2 is also called as bi. So bi is Bombay. So Bombay blood group defect is also going to be there. H antigen is not there, and in class 1 there is nothing but beta 2 which is at fault, whereas in class 3 all the 3, 1, 2 and 3, beta 1, beta 2 and beta 3, all the 3 are at defect. That's why this is not going to be working. So what is going to happen in leukocyte adhesion defect? See, important thing is that now the leukocytes are not going to adhere, but leukocytes will be there. Now because they are not adhering, they are not going to perform their normal functions also. So normally the umbilical stump which is there in the newborn is eaten by the leukocytes. Okay, normally I am telling, is eaten by the leukocytes, and then it is going to shed off. You must have seen. But because the leukocyte is not getting adhered, there is a delayed separation. It takes approximately more than 30 days of the umbilical cord. Okay, you got it? And sometimes omphalitis can also occur because there is no WBCs there, so there's nobody to prevent the infection, so there is going to be omphalitis which can occur there. So there is a recurrent bacterial infection history. So in the mucosa the child will have gingivitis, periodontitis, okay, dental infection, mucosal infection, and on the skin you will be having omphalitis, perirectal inflammation, labial cellulitis. All these things are going to occur. Okay, so can you understand, there is a leukocytosis which is there. Can you understand, there is a leukocytosis, there is abundant amount of WBCs which are going to be there in blood, but since they can't combine with the adhesion molecules, they can't work. So there is a baseline leukocytosis which is going to be there. There's going to be neutrophilia which is going to be there even without the infection. Leukocytosis means more than even 1 lakh per ml, and neutrophilia is also going to be there. So what you will do, you will do flow cytometry, and what you are going to see, LAD type 1, no expression of CD18, LAD type 2, CD15A is not going to express. And what will be the pathological findings? There will be lack of pus formation and infection sites. This is the hallmark feature. This is the hallmark feature, that there is lack of pus formation. Why? Because neutrophils are not going to act. If you know your general pathology, pus is nothing but the neutrophil extracellular trap. Now since the extracellular trap is not going to get formed because the neutrophils are not proper, so there is lack of pus formation at the infection sites. Okay, now how will you treat it? So what was the problem? That leukocytes are not going to get adhered. So we give the stem cell transplantation. Okay, so we give the stem cell transplantation. We do the stem cell transplantation so that there will be formation of beta 2 chain properly. There is formation of beta 2 chain properly, because LAD is 1 is the most common one. So this is the most common thing which is done. But in LAD2 you have to give fucose supplementation. Okay, you give fucose from outside, and fucosylation is going to occur. Okay, and of course because the oral mucosa, gingivitis and everything is so much, so you have to take care of oral hygiene, dental care. Okay, that's going to be the treatment. And see, sometime, I mean a lot of time ago, this question was asked that can you give the CSF, GM-CSF, colony stimulating factor, can you give? So colony stimulating factor can increase leukocytes, can increase neutrophils, but transmigration, adhesion, all these things are not going to get cured, so there is no point in giving the CSF. Okay, so let me just revise this for you. The various events is going to be, first of all, it is going to roll, and after rolling it's going to get adhered. Okay, adhesion is going to happen, right? So you have got some intracellular adhesion molecules. Okay, so can you see this one intracellular adhesion molecules? This blue one is the selectin, which we have talked about. These are the integrins which are present. So can you see, this question is also asked. Integrins are present on the surface of the cells, whereas intracellular adhesion molecules ICAM is present on the endothelium. Okay, endothelium. Okay, integrin has got this G, so G and C look very similar. So integrin is present on the cells. Okay, this is you have to remember. So this was a small brief video and I have tried to cover all the important points in this. Thank you so much for watching. God bless you. Meet you in the next class.